Good morning. My name is Dr. Neeraj Israni, and my topic today is a novel new age toric marker versus age-old toric marking. So there have been various innovations in toric marking, right from the manual handheld toric markers such as anterior stromal puncture, then the pendulum marker and the bubble marker, of course. Automated markers, on the other hand, such as the app-based marking, Callisto image-guided system, and the Varion image-guided system. However, we see that these are very expensive, and when we mark manually, we see a axis completely off like this. So we wanted to actually come up with an economical, accurate, stable, and easy to use toric marker. Now, we took inspiration from the Goldman's applanation tonometer. As you can see, the patient is very comfortable, and it actually goes and indents the eye at a very comfortable stage. We wanted to implant our marker into the calibration slot, which is universal for every slit lamp. So we came up with this idea, and this was the first hand-drawn diagram. As you can see, we further did a lot of 3D printing models, and as you can see, every time we 3D printed, it started becoming more and more bulkier. And we then finally settled with a shaft in a shaft design, which was basically, as you can see, this was our first prototype. And as you can see in the video, with the help of the knob of the slit lamp, it can actually go and indent the cornea at the desirable axis. So we just need to slightly invert the eye of the patient. We've worked up on that also in the further model, and with the help of the knob, we take it back. Further, this is the final prototype. As you can see, the toric dial and the axis is made of a stainless steel, and it has a achromatic edge which goes and indents the cornea. With the help of the blue mark, it also marks the blue mark, and there is an adapter with a bullseye levelometer, as it's called, which is supposed to make sure that it is perpendicular to the table of the slit lamp. So this is how it finally looks. So we did a very simple study where we wanted to see what is the efficacy and accuracy of this. So we took 50 eyes of anterior stromal puncture, and we took 50 eyes with our marker. And what we did was 50 eyes of both the group A and group B were compared to the gold standard, which is Varion. And as you can see, the same IOL power calculation software was used. The same surgeon performed these surgeries. Same technique was used. Not only that, the same machine was used, also the same IOL was used. So as you can see, the blue marks, which are the marks with our toric marker, and this is a Varion. Now 126 had to be aligned. Varion is showing 126 degree. What we did is we took a screenshot of this, and we used a digital planimetry software, which is paid software online. This basically gives us a complete circle of even minute degree of axis, and we measured the deviation of axis. So we basically measured how much is our toric marker's axis away from the Varion's axis. We did this on 8 days, 1 month, and we saw that so in the analysis we saw that with our marker, the deviation was 4.69 plus or minus 1.73, the least being 1.08 degrees. And with the other slit lamp marking, that is the anterior stromal puncture, the least was 1.66, so slightly better with our marker. Our biostatistician performed an independent student sample t-test, which again showed p-value significant with our toric marker. So as you can see, 50 eyes with anterior stromal puncture, deviation of axis approximately 4.07 degrees, and with ours it was 2.96 degrees, that is much lesser. So hence we were able to actually come up with an economical, accurate, stable, easy to use. I would like to end with just showing the final prototype or the final device, which is now available in the stalls at Epsilon for everybody to try. So as you can see, it's very easy. Just put it in the calibration slot. This is the bubble marker, it's centered, and you just put the toric marker. This also can be sterilized, has to be sterilized, of course. This is just for this thing, and you just screw it up. Now the dial is much smaller now, so you don't even have to invert the eyelid that much. Just take the mark the axis with the blue marker, take it actually goes and indents the eye. I will also show the markings in a picture next. So as you can see, it marks and also slightly indents the cornea. So even if after putting paracaine, it will not wash away. This is the beauty of this marker. Now final stage of hearing already published in Indian Patent Journal. Now I think hearing will be done very soon, and clinical trials are still going on. We want to increase the numbers and continue the studies. Thank you.
Very innovative indeed, Dr. Neeraj.
Thank you.
But I have few issues, okay?
Yeah.
When you sent in your initial summary, that was on 30 cases.
Yes.
And finally, when you gave the final write-up, that was on 25 cases. Again, you have presented on 50 cases,
yes.
But your statistics haven't changed.
No, so
the average mean remains the same.
Yes.
The p-value remains the same.
Yeah, there is a reason for that, because
please.
First 25 eyes was performed with the 3D printed marker.
Okay.
And now that I have this, I have basically added those, and the difference is almost the same. Only thing is the dials become smaller now. So basically with both of them, the statistics, I've tried to keep them the first statistics itself.
Yes, I realized that they are the original statistics that you had sent in.
Yes, that's right.
And the thing is that, that it does not need to be individualized for each slit lamp. That is also very nice to know. But I think the marker has to be autoclaved repeatedly, and it being a stainless steel, is it going to, what the calibration of that marker is it going to be affected in the long run?
So there is a solution for that also. See, the entire body is made out of aluminum stainless steel. This does not need to be autoclaved because this can be permanently fixed on a slit lamp. This is the only thing which is detachable. This is the only thing that needs to be autoclaved. What you need to do is, just once you autoclave this with the help of a chittle, you can just put it in this, and you have to just adjust the screw. That's it. So that is the only autoclavable part. And I have been, just because the video I wanted to show a very raw video, but I have, whenever I mark, I autoclave it and mark it, especially in pre-op cases.
Yeah, a very good initiative.
Thank you, sir. Thank you.
Dr. Neeraj,
yes, sir.
you have not declared any financial interest in this presentation.
Sir, now I have financial interest
You have financial.
because it is available in the
And though it's not a part of your presentation, have you compared with other markers like bubble markers and this thing?
no, I have just compared with anterior stromal puncture. But yes, there are future studies will be done comparing it with other markers also.
And also some softwares are available on
Applications.
applications. You
Definitely.
can compare with those also.
Definitely, sir. Definitely.
Thank you.
Thank you, sir. Thank you. Thank you, ma'am.